Hello everyone and welcome back to our channel. So let us continue with the female reproductive system. So the organ which we are going to consider in this particular video is the uterus. Okay, the uterus, which is also known as womb, it actually is a part which acts as the pathway for the sperms which are deposited in the vagina. Okay, so it has several functions. Okay, so the sperms which are deposited in the vagina during the sexual intercourse, so they need to fertilize the ovum which is present in the ampulla, right? We have seen that the fertilization which occurs in the ampulla of the uterine tube, right? So the sperms have to travel through the uterus and through the uterine tubes to reach the ampulla for them to fertilize the ovum. Okay, so uterus, it will act as a pathway, okay, through which the sperms will have to travel. Again, apart from that, it is also site for implantation of the fertilized ovum. So once the fertilization takes place, as we have seen earlier, that the fertilized ovum, which will now get converted into zygote, it will slowly travel along the uterine tubes to reach the uterus, and the implantation will take place in the uterus. So further it will grow in the uterus, it will get implanted over here, attached over here to the wall of the uterus, and it will start growing in the uterus until the completion of the pregnancy. So this fetus, it grows in the uterus during the pregnancy. Also the childbirth, it takes place through the process of labor. Labor is the process wherein the contractions of the walls of the uterus, it will help in the childbirth. Okay, then apart from that, during the reproductive cycle, the female reproductive cycle, these are some cyclic changes which take place each month in the female. Of course, we will consider this reproductive cycle as well in detail. So throughout the reproductive life of a woman, the reproductive cycle will take place. So during these reproductive cycles, supposing if the fertilization does not take place, okay, so once the secondary oocyte is released, it will reach the ampulla where the fertilization should take place if the sperms are present. Now supposing if the fertilization does not take place, okay, implantation will not happen, right? So at that time, the uterine wall, the innermost wall of the uterus, it slows off. Actually, it prepares itself to receive the zygote for the implantation. But then when the fertilization does not take place, this internal layer, that is the endometrium, the part of internal layer, it will slow off. That is, it is lost. Okay, so it's not a permanent layer. We will come to which layer exactly it is a temporary one. Okay, so it slows off and it becomes a source for menstrual flow. Now, coming to the anatomy of the uterus. Okay, so location, if you can see, it is located in between the urinary bladder and the rectum, right, somewhat superior to the urinary bladder. So this is the position of the uterus, and it is in the form of an inverted pear. If you can see the shape of the uterus, it resembles an inverted pear, the fruit. Okay, now coming to the dimensions. Okay, in the females who have never been pregnant, that's very important, in whom pregnancy has not taken place, never taken place, the dimensions are 7.5 centimeter long, that is this one, then 5 centimeter wide, that is from side to side. Now we are having a look at the sagittal plane. Okay, so from side to side, 5 centimeter is the dimension, and 2.5 centimeter is the thickness, that is from front to back. Okay, so these are the dimensions of the uterus. Now somewhat size is larger in the females who have been recently pregnant, and it is somewhat smaller, that is atrophied, when the sex hormone levels are low, say in case of menopause, okay, after which the menstruation stops. After this period, the size of the uterus is slightly smaller. Now coming to the anatomical subdivisions of the uterus, what are the parts into which this uterus is divided into? Okay, so this particular picture shows the internal details as well. Okay, so but basically uterus is divided into three regions. Okay, the dome shaped, as you can see, this is the dome shaped superior portion, which is superior to the uterine tubes. This is the point of origin of the uterine tubes, right? So just superior to that, the dome shaped structure, that is known as the fundus of the uterus, fundus. Then inferior to the fundus, the middle portion or the central portion of the uterus, this is the one, this is known as the body of the uterus. And the inferior portion, this is the one, the inferior portion which is tapering in nature, it is known as cervix. Okay, cervix of the uterus, this is the cervix. This is the body of the uterus. Okay, here it is shown, and this is the fundus of the uterus. So these are the three parts into which the uterus is divided into. Now in between the body and the cervix, there is a small portion measuring round about 1 centimeter long, and that is known as the isthmus, which connects the body with the cervix of the uterus. Okay, now let us talk about the interior cavity. Okay, so this particular organ, internally it is hollow in nature, so it should accommodate the zygote, okay, which is implanted and it will grow as a fetus. So there is a cavity which is present within the uterus. Now the cavity or the space which is present interior to the body of the uterus, that is this portion, the middle portion, this region is known as uterine cavity. And the interior of the cervix of the uterus, this one, last part, this is known as the cervical canal. Here, the cervical canal, this is the cervical canal. Now this cervical canal, it opens into the uterine cavity, and that opening is known as internal os. Os means mouth like opening. Okay, so the opening of the cervical canal into the uterine cavity, it is known as the internal os, and the opening of the cervical canal into the vagina, which is the next part. Okay, so this opening is known as external os. Okay, internal os and external os. Internal os is the one which is present in between cervical canal and the uterine cavity, and external os is the opening between the cervical canal and the vagina. Okay. Now the position which the uterus occupies, it is projecting anteriorly, as you can see, this is the anterior portion, this is the posterior portion, right? So as you can see that it projects anteriorly and superiorly over the urinary bladder, and the position into which it is placed, it is known as anteflexion. Ante means before. Okay, and cervix, as you can see over here, it projects inferiorly and posteriorly, and it enters into the vagina at right angles, right? It's almost a right angles at which it is opening into the vagina. Okay. Now this uterus, it is held in position by a number of ligaments. Okay, so these ligaments are nothing but the folds of the peritoneum which are holding the uterus in place so that it maintains its position. Okay, so coming to the different ligaments, the first one is the paired broad ligament. So there are two. As you can see, this one, this is a broad ligament. So it's the fold of the peritoneum which attaches the uterus on either sides of the pelvic cavity. So there are two broad ligaments, right? This one and this one, right and the left one, which attaches it to the pelvic cavity laterally. Next one is the paired uterosacral ligaments. Okay, as you can see, broad ligaments can also be seen over here. and the uterosacral ligaments. These are the ones. So as the name implies, these are the peritoneal extensions which lie on either sides of the rectum and connects the uterus to the sacrum. Okay, sacrum, that is towards the posterior side. This is the posterior side, right? As you can see, these are extending posteriorly. It is attaching it to the sacrum. Next ligaments is the cardinal ligaments or lateral cervical ligaments. Okay, these are the ones. These are located inferior to the bases of the broad ligaments. So they are located inferior to the broad ligaments. So location we have seen, broad ligaments are located laterally, right, on either sides of the uterus. Okay, so just inferior to that are located the cardinal ligaments. Okay, and they extend from the pelvic wall to the cervix and the vagina, that is to the lower parts actually of the uterus as well as the vagina. Then the round ligaments. So these are the bands of fibrous connective tissue which are lying in between the layers of the broad ligament. So they extend from the here these are the broad ligaments. These are the ones. Okay, so these are extending from the point on the uterus just inferior to the uterine tubes. So where are the uterine tubes now? These are the ones, right? So just inferior to that originate these round ligaments and they extend to a portion of labia majora. Now labia majora, it is actually the part of external genitals. We will be considering this external genitals also in the next video. But just remember that these round ligaments, they are anchoring the uterus to the labia majora. Okay. Now, though the position of the uterus is in anteflexion position, but sometimes the uterus, it may get malpositioned as well, because there is sufficient space to allow the movement of the uterus. Okay, so sometimes the uterus may be tilted posteriorly. Now as you can see that it is tilted anteriorly. So sometimes it may happen that it is tilted posteriorly, and that position is known as retroflexion. Retro means backward or behind. So this is a harmless variation of the normal position actually. Okay, so sometimes it may occur after the childbirth. Then this to do with the anatomy. Now coming to the histology of the uterus. So histologically, if you can see, it discloses the 3 layers of the uterine wall. Okay. So the 3 layers are from outside to inside. The outermost layer is the perimetrium, middle layer myometrium, and the innermost layer is the endometrium. So as you can see, this is perimetrium, the middle layer is myometrium, and the innermost layer, a little bit dark in color, this one is the endometrium. So the names also imply the position of these layers, right? So outer layer, that is the perimetrium. Peri means around and metrium means uterus, or this is also known as serosa. So serosa means it's actually a part of visceral peritoneum which covers the uterus. Okay, so it composed of the simple squamous epithelium and the areolar connective tissue. So this particular layer, perimetrium, it is covering the uterus. Laterally it becomes the broad ligament. Okay, so it's a part of visceral peritoneum actually. Then this particular perimetrium, which is covering the uterus, it forms 2 pouches. Okay, as it is covering the uterus, they form 2 pouches on either side. Now as you can see over here, this layer of perimetrium, it is forming a fold in between the uterus and the urinary bladder. As you can see, this one here, there is a small pouch which is formed over here, right? So that pouch is known as vesicouterine pouch. Vesico means bladder, you are all aware of. Okay, so vesicouterine pouch, the pouch which is formed in between the uterus and the urinary bladder. Okay, so also the same perimetrium also forms another pouch posteriorly, as it forms a fold over the rectum. This is a rectum, right? So here again one more fold is formed, and that is known as the recto-uterine pouch. Recto means rectum, or it is also known as pouch of Douglas, which is the most inferior point of the pelvic cavity. So this to do with the perimetrium, which is the outermost layer of the wall of the uterus. Then coming to the middle layer, that is known as myometrium. Myo means muscle. So it's very clear that this particular layer, it is made up of smooth muscle fibers. Okay, now there are 3 layers of smooth muscle fibers, which are thickest in the fundus and thinnest in the cervix. Okay, so coming to the 3 layers of the myometrium. So this is the transverse section to the uterine wall. So as you can see that there are 3 layers, that is the endometrium, myometrium and the perimetrium. So we'll focus on the myometrium now. There are 3 layers of the smooth muscles I told you, right? So inner layer and the outer layer, these are arranged in the longitudinal fashion. And the middle layer of the myometrium, it is circularly placed. So during the childbirth, during the labor and the childbirth, it is the coordinated contraction of this particular layer of the uterus which aids in the childbirth. Okay, that is the expulsion of the fetus from the uterus under the influence of the hormone oxytocin, which is secreted by the posterior pituitary. Okay, then coming to the 3rd layer, that is the innermost layer of the uterus, that is known as endometrium. Endo means within. Okay, so endometrium, this is highly vascularized layer and it has 3 components. The innermost layer, it comprises of simple columnar epithelium. So the lumen of the uterus, it is lined by the simple columnar epithelium. Now these are ciliated as well as secretory cells. So they will secrete certain secretions and they have cilia on them. Okay. Then underlying endometrial stroma, this is a very thick region of the lamina propria, just underlying layer of the lamina propria. It will obviously comprise of the areolar connective tissue, and apart from this there are present endometrial glands or the uterine glands. So these are the ones, as you can see, these are the endometrial glands. Okay, now this layer endometrium, so these are the 3 components of the endometrium, but this particular layer endometrium, which is the innermost layer of the uterus, it itself is divided into 2 layers, stratum functionalis and stratum basalis. Okay. So the stratum functionalis, which is also known as the functional layer, this actually lines the uterine cavity and it slows off during the menstruation. Remember I told you that the layer of the endometrium, it slows off, right? It is this layer, stratum functionalis. Okay, so the endometrium is divided into 2 layers. The one which is present towards the lumen of the uterus, the innermost layer, that is stratum functionalis, and the one which is attached to the myometrium, that is known as stratum basalis. This is actually a basal layer, this is a permanent layer, and this is the temporary layer. Okay, so stratum basalis being a permanent layer, once stratum functionalis slows off, new stratum functionalis has to be formed, right? So that is formed by the stratum basalis. So it will give rise to new stratum functionalis layer after the menstruation. Okay, so this to do with the endometrium. Now coming to the blood supply to the uterus. Now the uterus is richly supplied by the blood because it needs to nourish and grow the fetus, right? So it is richly supplied by the blood. So the branches of the internal iliac artery called uterine arteries, these are the ones. So these uterine arteries supply to the uterus. So these arteries, as they penetrate deeper and deeper into the layers of the uterus, they go on dividing into smaller branches. Okay, now these uterine arteries, they further have started divided, right? Now as they penetrate into the myometrium, okay, as you can see, these are entering in the myometrium in the form circular fashion, right? So these are known as arcuate arteries. Arcuate, we have already seen the meaning of this word arcuate. Arcuate arteries are the ones which are shaped like a bow. Okay, that's why these are known as arcuate arteries. So these will penetrate into the myometrium, which is the middle layer. So further, these arcuate arteries will branch into something called as radial arteries. Okay, so these are uterine arteries which will divide into arcuate arteries. Arcuate arteries will further, as they are penetrating deeper, they are divided into radial arteries. Okay, so these radial arteries will penetrate deep into the myometrium, and as they are entering into the endometrium, which is the innermost layer, further these radial arteries will branch into two arterioles, that is the straight arterioles and the spiral arterioles. So the straight arterioles, these are the ones which are supplying. Now as you can see, these are the details of the endometrium, right? So this is the stratum, yes, stratum functionalis, and this is the stratum basalis. So the straight arterioles are the ones which are supplying the outer layer, that is the stratum functionalis, a permanent layer which is close to the myometrium, and the spiral arteries are the ones which are supplying to the deep layer, that is the stratum functionalis, which is a temporary layer. Okay, then the blood will leave the uterus through the uterine veins, which will in turn drain into the internal iliac veins. Okay, so there is an extensive blood supply which is essential for the regrowth of the stratum functionalis after the menstruation. Also implantation of the fertilized ovum take place, or development of the placenta also should take place. So for all this, the uterus is richly supplied by blood. Okay, so this to do with the uterus. Now there is a small concept called cervical mucus. So the mucosa of the cervix, it is lined by the secretory cells which produce a secretion called as cervical mucus. Now this mucus, it is composed of water, glycoproteins, lipids, enzymes and inorganic salts. Okay, so during the reproductive years of a female, round about 20 to 60 ml of the cervical mucus will be produced per day. Okay, so this cervical mucus, why it is produced? Okay, so it's actually hospitable to the sperm, that is, it increases the chances of the survival of the sperm in the female reproductive tract. Okay, usually this mucus production, it occurs at the time of ovulation. Okay, ovulation is the release of the secondary oocyte, right, by the rupture of the mature follicle or the Graafian follicle. So to increase the chances of fertilization, this cervical mucus is produced somewhere around the ovulation. Okay, so this mucus, it is less viscous actually at this particular time and more alkaline. Remember, the alkaline pH is necessary for the survival of the sperm, so it increases the chances of sperm survival. And at other times it is more viscous and it forms a cervical plug that impedes or prevents the entry of the sperm at the other time. Okay, because the fertilization will not take place, right? Fertilization, it will take place only when ovulation has occurred, right? So conditions are made more hospitable during the ovulation, so then at that time there are more chances of fertilization. So this cervical mucus which is produced, it aids in the energy needs of the sperm. Okay, so also it protects the sperm from the phagocytes and the hostile environment of the vagina and the uterus. So also it will help in capacitation. Remember capacitation, it is a series of functional changes which the sperm will undergo in the female reproductive tract, okay, just before it can fertilize the secondary oocyte. So capacitation, it causes the sperm's tail to beat even more vigorously so that it will reach the secondary oocyte at a faster rate. So also it prepares the sperm cells plasma membrane to fuse with the oocyte plasma membrane. Remember the fertilization, once the penetration takes place, the plasma membranes must fuse, and later on the nuclear material will also fuse together, right? So capacitation is a process which will increase the chances of fertilization. Okay, so this is to do with the uterus and the cervical mucus. Okay, so this is the reference for my presentation. Thank you for watching.